So far this year, no human cases have been reported in the state, but that doesn't mean health officials aren't concerned. Some local health departments are reporting the West Nile virus has been found in some mosquito batches. Stay with us. What you need to know about the West Nile virus tops this week's At Issue. The West Nile virus is most commonly transmitted to humans by mosquitoes. In Illinois, the virus was first identified in September 2001 when lab tests confirmed its presence in 2 dead crows found in the Chicago area. Now, by the end of 2002, Illinois had counted more human cases and deaths than any other state in the United States. Health officials say the best way to prevent West Nile is to reduce the number of mosquitoes around your home and neighborhood, something that can be, well, rather difficult in the summertime, especially this season when there's been a lot of rain. Well, with more on the virus and the situation this year, we're joined by Coles County Health Department nurse Mara Hildebrand. Thank you so much for joining us.
Thanks for having
You know,
me.
I'm in the news business. I'm the news director also at WEIU, and I can tell you, since 2002, we have done numerous stories over the years on West Nile. This year, though, it seems to have slightly died down a bit as far as the media is concerned, and but it's still out there, and people still should be concerned about mosquitoes and proofing their homes, regardless of whether or not there's a media report on it every single night. So thank you for joining us.
Yeah.
And I think, you know, we should start with what is West Nile encephalitis?
Okay. West Nile is a virus, and it's transmitted to humans via mosquito bites. The mosquitoes get the virus from feeding on infected birds, and then the mosquitoes feed on humans and can infect the human with the virus. West Nile virus can be a fever, and it can be encephalitis, it can be meningitis. Encephalitis is inflammation of the brain. Meningitis is inflammation of the outer brain and spinal cord. Most commonly, actually in 70 to 80% of cases, West Nile virus has no symptoms. If you actually get infected with the virus, 70 to 80% of people will not have symptoms. Symptoms can also be a fever, like I said. You can develop a rash, joint pain, body aches, headaches, stuff like that. And also, severe illness would be the encephalitis and meningitis, but it's like a 1% of cases will actually get that, severe of a case. And when you do have like the fever, the rash, the body ache, the influenza-like symptoms, you can get past that, but then you can have extreme weakness and fatigue for weeks or months afterwards, and then it would take quite a long time to recover from the extreme symptoms such as encephalitis and meningitis, and it can cause seizure and everything else. So
from the time that, let's say that you or I are bit by a mosquito,
Mm-hmm.
it could be, it's not an immediate.
It doesn't have to be, no.
No.
The incubation period for the virus is usually between 2 and 14 days, so it can take a little bit to develop symptoms, and that's why it might be hard to diagnose sometimes, because people, you would generally know when you're bit by a mosquito, but it could have been, several bites, or, you forget by the time you get symptoms, so yeah, it can be tricky.
Does it seem to attack, if you will, people of a certain age group, or are certain people prone? Is it young? Is it middle-aged? Is it seniors that might be more susceptible?
Anyone is susceptible to West Nile virus, especially people that work outdoors, obviously, people that spend a lot of time outdoors. From dusk to dawn is the most common time to see the large amount of mosquitoes. People 60 and over are at increased risk for the severe symptoms from the virus, so they are definitely the ones that need to be careful against mosquitoes. So,
if you suspect a family member yourself might have some of these symptoms, I mean, instantly, what should you do? Should you?
You would, if you develop a fever-like illness after a mosquito bite, or a rash type illness after a mosquito bite, or in general, you just get to your physician as soon as possible, and they would have to do, the signs and symptoms the clinical signs and symptoms that you have, along with diagnostic testing, will give them the answer if you have the virus or not, and that would be blood tests or spinal fluid tests. So, and there is no treatment for West Nile virus. There's, you can take fever reducers for the fever, and Tylenol and stuff like that for some of the symptoms, but generally speaking, there's no treatment for the virus itself. It just kind of has to take its toll on you, and your body has to fight it off on its own. So that's the hard thing about that.
It is hard, and some people out there watching may wonder, is there a vaccination? I mean, we all get bit by mosquitoes.
Sure, all the time.
All the time. You're at
Yeah.
a ball game, you're mowing the lawn, you're at the swimming pool. Everywhere you go, there are mosquitoes, and especially this season when we've had all of this rain, mosquitoes love the moisture. They love to hang around areas like that. Is there been any talk or discussion about what we can do to immunize ourselves against this?
Sure. There's no immunization at this time. However, they have been researching it for quite a while now, and hopefully there'll be one out, sometime in the future, but there hasn't been any speak of how soon that would be, but they are and have been working on it for a while to develop a vaccine. The best thing that you can do is protect yourself from mosquito bites in general whenever you are outside. Like I said, from dusk to dawn is the time frame when, if you don't wear protective clothing or insect repellent, you should just stay indoors. That's just when they are most likely to be around, and when you would get bitten. Protective clothes like long sleeves or long pants to protect your skin from a mosquito bite. Insect repellent with DEET is, the best bet on the accurate protection against them, and just reapply as it says on the bottle if you're out a long period of time. Some things you can also do to mosquito-proof your home, as you were speaking of, would be to repair any, broken screens or cracks in the door where bugs could actually get inside your house, and eliminate standing water around your house. Like if water is accumulating in flower pots, make sure they stay dumped out, and they always talk about the old tires that hold water. Get rid of those. Anywhere that you can clear out standing water around the home would really help eliminate them.
People might say, let's be honest, it's the middle of summer and it's 100 degrees out. Humidity is sometimes unbearable, and I'm going to wear long sleeves and pants.
Exactly.
I mean, that's what people are going to say. So if we take that out of the equation, is repellent there is no vaccination, so repellent is, so maybe let's go a little deeper in the repellent issue. How often should you apply it? I know I live in the country, so I'm outside a lot.
All the time, yeah.
All the time. Is it, if I spray it once, am I okay, or?
Generally, you would want to, spray your clothing and exposed skin. You do want to stay away from wounds or a break in your skin or irritated skin, and the face, obviously. But you would just apply it as well as you possibly can, and the bottles usually, depending on what time you use, will say how often to reapply. But if you're out there for a while and you notice that you are getting bitten all of a sudden, I would definitely reapply it because it's obviously wearing off. But
geographically speaking, in the state of Illinois, or just geographically in the U.S., where does West Nile seem to be most prevalent? Is most cases, we spoke about this in the intro, that it was first brought in New York. That's when it was first identified. And then there was a time period when migrated out west to Colorado, but then it found its way back. Illinois has seemed to always top the list when it comes to the number of cases and deaths. So would you say that we top the list, or what area is? It's
pretty much everywhere. It's all over the United States, the lower 48 United States. It just depends on weather. The weather is a big factor, and how many birds are out there that are infected, and how many mosquitoes, are feeding on those birds and getting themselves infected. So it really varies on the season and, what the population is like out there with the virus. It's unpredictable.
A lot of questions surrounding blood donations.
Yes.
Let's say that I want to give blood, but I have been susceptible to the West Nile virus. I've not had it. But, if I'm out there wanting to give, can I give if I've had it? Or let's say that I need a blood transfusion and I'm concerned about maybe getting some blood from somebody that has had the virus. Is that something that people should be worried about? Is blood tested when it's given for West Nile? Or is that something, I know you have some information as far as getting it and giving it to somebody else.
There has been very few cases, but there has been a very small amount of cases where the virus was transmitted through organ donation or blood transfusions or from the mother to the child during delivery or breastfeeding. If you do develop the virus, it would be the physician would need to discuss with you what you should do, regarding blood donation or organ donation or anything like that, the time frame and that type of stuff, the testing.
So there have been very minute
small
cases,
small amount of cases, that has been traced to that being the reason of the infection.
You work for the county health department, and the state has a very sophisticated system. Like I said, when West Nile was first identified in the United States back in 2001, 2002 it erupted. Since then, the state has been very active in coming up with a system for tracking insects and other animals. And we might talk about that because it's not just mosquitoes, but being a part of the health department system. Can you talk about the state monitoring system and what goes on and what is the monitoring system and how the community is involved in that process?
Sure. I deal with communicable diseases specifically. So when a case is reported to me either by a laboratory that has done the testing that confirmed it positive or a physician's office or something like that, a hospital, I will investigate the case specifically to the person that was diagnosed and find out where they have been, what they've been exposed to, if they have, noticed the bite or the rash or all this kind of stuff, get their symptoms and everything in their travel and exposure history, stuff like that. As far as if people find a dead bird, per se, they could call the health department and arrange for, the bird to be picked up and tested and all that kind of stuff, and the state would work with us on that one. If there is a large number of cases or an outbreak type situation, then there would be, insecticides and everything come in and take care of, like a mass problem. The state would aid with that. So you can always get involved with, the environmental health end of things and find out what you can do, as we discussed, to prevent the mosquitoes in your specific area. They do have control programs with insecticides if needed and the testing of the birds and everything like that. But the electronic monitoring of the actual disease itself, on my end, it's reportable, so I would know about it and be able to investigate the specific case, and that way they can find trends with, what these people had in common and what the problem is, and hopefully get it addressed. So.
And there are also local counties that do batch testing on mosquitoes.
Yes.
Can you talk about that? And is your department active, or do you partner with other departments just to share information?
Sure. If there was a problem in a county, we would definitely be talking with others regarding their situation. I'm not sure if our environmental health is testing at this time. I know that they have the ability to do that if they need to, but there has been West Nile in this area in Illinois located in mosquitoes. So,
is there a concern once? Let's say, I know that Macon County has tested positive for a batch. Now, a batch, I don't know how many that is.
Right.
It just, they probably set up some sort of trapping system. They get the mosquitoes and they test them. If it is found in a county that the mosquitoes do test positive, is there a high likelihood that you can expect there to be some illness
Yeah.
in that county.
Yeah, it would be definitely something to put people on high alert to make sure that they are wearing their insect repellent and, protecting themselves from dusk to dawn if at all possible, and, eliminate standing water. And it just puts people into like a beware state so that they can protect themselves. It is alarming whenever you find out that they're positive in your area, so you want to do everything you can to, and that's why it's on the news, so that people know that it's out there, so they hopefully take the extra steps to protect themselves.
In your position in Coles County, and I know we can't get specific on patients and people, but can you talk about cases that you've experienced over the years? Coles County has had cases of West Nile.
Yes.
Maybe how far back it goes, the last few years, or?
Yeah, I didn't look that up. I've been with the health department for about 3.5 years now. I believe that I've had a couple cases, but I don't know specific numbers. I didn't look that up, but nothing like severe or fatal events.
What were some of the symptoms that you remember with these cases?
Fevers and body aches, joint aches, back pain. Some not always a rash. A rash isn't always in the process there.
Is the rash around the bite?
It can be just a generalized rash anywhere.
And they're young, middle-aged, old patients?
I believe there's been a couple. I mean, they were all adults. They were all adults. I believe middle age.
So if just to take you through the process and the reporting process of it, if I get bit, a period of time elapses and I get sick, and I go to either my local physician or if it's bad enough, you would go to an emergency room. So then they diagnose you, and then if they believe that it's the virus, do they report back to the local county reporting agency, so that way that information is shared?
They're supposed to. If they suspect it, it is nice that they would let us know that. If testing is done, which hopefully it would be, it's sent out, and whenever the actual positive test is known, then that's when I would get involved. So if the doctor doesn't report that to me, then generally the laboratory or the hospital itself, infection control personnel, would be the ones that would report that to me.
I know that you stay on top of reports and information coming out of the Centers for Disease Control. I guess looking ahead in the future, do you see that this going away?
Yeah.
I guess it's hard to predict.
It's hard to predict, but it is substantially out there in the United States, so hopefully maybe one day it would move on and no new infections and it could kind of die out, but there's no way to tell. No way to tell,
and no cure at this point, but just get to your local physician or doctor if you experience these symptoms. What's interesting, Maura, is when I was doing some of my research on West Nile, I came across another interesting topic. We'll just talk about it briefly because we're going to move into yet another topic in this discussion. But I found it interesting. We're talking about mosquitoes and insects carrying the West Nile virus to humans. What I also found interesting in my research is ticks in Illinois. Now, obviously, ticks aren't carrying the West Nile virus, but researchers have said because of last year's very hot summer, drought, and then a relatively mild winter, that there are an increased number of ticks in the state of Illinois. Can you talk briefly about that situation and also what ticks can carry here in Illinois?
Sure. Ticks are a problem, again, with outdoors. Whenever you are outdoors hiking or walking trails, or if you have a yard that has tall grass or brush or something that would hold ticks, that's the type of vegetation that they live in. You would want to protect yourself with, again, the protective clothing, and they say light-colored clothing is better to see the ticks on, and you would want to check your person for ticks themselves and remove them promptly. And if you do have a tick bite, you would want to wash the area and wash your hands and apply, medication to the site. Some of the diseases, the deer tick specifically carries Lyme disease, and that is treated with antibiotics. All of the diseases that ticks carry are generally treated with antibiotics, so that's a good thing. The Lyme disease has that target rash that people talk about seeing. And you don't always have to have the rash or remember that you got a tick bite. Some people don't ever know that they got bitten by a tick, but the Lyme disease is that target rash around the actual bite, and then they can also have influenza-like symptoms, a high fever or muscle aches, body pain, stuff like that, fatigue and malaise feeling. Now, Rocky Mountain spotted fever is another one that is a disease carried by ticks that you can get from a tick bite, and that would be a high fever and flu-like symptoms also. So if you are out in an area where ticks are common, or you know for sure you got a tick bite or anything like that, and you see a rash or flu-like symptoms afterwards, you definitely want to get to the doctor as soon as possible, and they'll get you started on antibiotics and do some testing also, blood testing also, to find out what specific thing that you would have. They speak of wearing socks when you're hiking or out in the country, to tuck your socks into your pants, and you can even put tape around that to make sure that ticks don't crawl in there, because ticks don't fly or hop, they crawl, but they can be on your clothing and then crawl to an area where there's exposed skin and bite you. So that is always an issue. And there's insecticides that protect against ticks also, and if you're walking trails or something, they say to stay in the middle of the trail so that your clothing and everything doesn't brush the vegetation and stuff like that, and to keep your lawn manicured, because they typically stay away from low-cut grass and stuff like that. So, and animals also will pick up ticks being out and around, especially in the country, so you want to check your animals and your children and yourself for ticks. One thing about ticks is that they have to be attached for quite a while, even up to 4 hours, before they will actually transmit the diseases. So if you check yourself, every couple hours and remove them promptly, then you have a safer bet of not getting a disease from them. But if you are in a tick-prone area, or if you know that you got a bite, obviously, you would want to get to the doctor right away if you get a rash or a fever-like illness.
When you mentioned, and we should probably discuss this in the last few minutes that we have of today's interview, when you were speaking of illnesses that you could get from a tick bite if it develops into that as flu-like.
Yes.
So let's talk about the flu,
Okay.
because believe it or not, the season for flu is November to April, but the health department is, they're getting the word out now, and people really should need to think about being immunized. So
Yes.
talk about the strand this year that we will be likely to see, and when should we get the shot?
Sure. They say CDC recommends now to get the vaccination as soon as it becomes available at your doctor, your health department. The season typically starts in October, and it typically peaks January or February, but we will be receiving the vaccine at the Coles County Health Department, should be the end of August to beginning of September, and we will be getting it out to people as soon as we get it, just for the protection. They used to say that you want to wait as long as possible to get the vaccine so that you're protected when it's prime, but nowadays they definitely want you to get the influenza vaccine, every year for everyone 6 months of age and older, to get it as soon as possible, as soon as it becomes available. So this year at the Coles County Health Department, we will be offering, it's a new vaccine against influenza. It's called a quadrivalent vaccine, which means it has 4 types of antigen in it to protect you from the influenza virus. There's typically there's been 2 types of A and 1 type of B antigen in the vaccine, and this year the quadrivalent will have 2 types of A and 2 types of B, just to better protect you from what you could encounter in the flu season. So that's available, and we also offer the high-dose influenza vaccine for adults 65 and over, and that is because the human immune system, as we age, does get more suppressed, and we're not able to fight off stuff as well the more we age. So our immune system is more susceptible to diseases, and the high dose just offers an extra boost of the antigens so that we can hopefully get a better antibody response, and then better protection from the influenza if it's encountered, because 65 and over is also at more high risk when they get.
Talk about the different strains. What does that, we've got just a couple of minutes here, but I don't think most people understand that when we talk about H1N1, H3N3.
Right. So there's influenza A and there's influenza B. that generally affect, the population here. And influenza A, if it's an influenza A dominated season, it's generally more severe influenza-like illness, higher fevers, more fatigue, more malaise, more body aches, stuff like that. And an influenza B dominated season would be a little more mild symptoms. But influenza is fever, cough, fever, cough, and malaise, fatigue, body aches, chills. It's all upper respiratory symptoms. So the fever, the cough, and the fatigue and stuff like that are the most common symptoms.
And typically you don't get sick from the flu shot. I think that's another thing people think.
Yes, that is a very common misconception. The influenza vaccine itself, the shot, is inactivated, and there's no way to get it. It's an inactivated, deadened virus, so there's no way to get it from that. It can get a side effect that would be, you could get a headache or a tired feeling or even a little bit of body ache from a side effect of the vaccine that people would commonly think would be the actual getting it from that. But you're not getting the virus. The virus is extremely bad when you get it, and you would know that you got it. It wouldn't be just a day or two later after the shot, I didn't feel so good. You would be down and out for quite some time. So.
But again, lastly here, the health department will be getting the vaccine at the end of this month. So if somebody out there is watching, they could just contact your office and find out.
And we'll put it in the paper and stuff like that. So.
Great. Yeah. Well, Mara, thank you so much for joining us. I actually learned a lot myself today about the various topics. And if there is a topic out there you'd like discussed here on At Issue, contact us at weiu@weiu.net. For At Issue, I'm your host, Kelly Runyon. Thanks for joining us.